Well, there's about 400 babies that are born from Nolan County every year, and about half of those, a little bit more than half, actually are born here in Rolling Plains. Our current OB was built in 1976, and it's gone through a few small transformations, but still uses a lot of the same types of care that we used several decades ago. So we saw that there was a big need in our community to upgrade our facilities, and rather than do a renovation in that area, we decided to go from the ground up. So we are very excited to build out this beautiful new labor and delivery department that has all of the bells and whistles that you would find in the big city.
With our new technology that we'll have in our bigger rooms, I feel like we'll be able to accommodate our moms more.
We are going to have 7 LDRPs instead of 3 and some postpartum rooms.
What's the most exciting about the new unit is the LDRPs, which is labor, delivery, and postpartum rooms, which means when moms come in, they will stay in the room and they'll get admitted into the room, deliver the baby in the room, and then they'll stay there after.
It used to be you had a baby and the baby got taken to the nursery and brought out to you periodically. And so you were separated from your baby a whole lot and had less control.
Babies are going to get to stay with mamas the whole time. We have all the instruments and devices we need in the rooms so that your baby never leaves your side, and that's the best part.
You get more time for bonding and the real life experience that you're going to have forever.
I'm just looking forward to a new facility to offer to patients around here a location that is central, that they don't have to travel far to get the care that they need.
It's going to encourage a lot of the family members in Sweetwater to stay here as opposed to driving to a bigger hospital.
We will also have a surgical suite in our area where we will be doing C-sections in that department instead of in the OR.
I am so excited about the new facility, mainly because we're going to have a C-section suite in the actual labor and delivery area. We don't have to go to the OR anymore.
This gives us a vastly expanded OB department. We have surgery right in our same department and all new newborn nursery.
We're going to have some new warmers in the new unit, and they will have all of the monitors on them and all of the resuscitation equipment that we need for our babies.
We can monitor there, and you don't have to have the baby taken away to do, check their blood pressure, check their oxygen level, or you don't have to have your baby taken away to do any of the nursing procedures. Really, we're going to do all the baths and everything in the room. So, you're with your baby in that time and you're bonding, and it's just going to be wonderful.
Anybody who's planning on having a baby needs to be comfortable with their physician and with the facility that they're going to deliver in. And we have good staff here. And now we're going to have a great facility, so I think it will help a lot with keeping people in town.
We're going to be focusing more on mother-baby care and encouraging our moms to room in more, and we are starting the Texas 10 Steps here and encouraging more family-centered care.
With the Texas 10 Steps, we'll become a hospital that is pro-breastfeeding, and we're doing all we can to help these moms out.
There is a great deal of education that can help a new mom and a new family better care for an infant and prepare for their pregnancy and prepare for the delivery of the baby. And our staff has taken full accountability for educating themselves and providing great state-of-the-art education.
And they make sure that they educate the patients about breastfeeding, and we have a breastfeeding initiative. We do the skin to skin right when the baby is born with the mother. That's very important just to start the process of encouraging breastfeeding, and I'm really glad that the nurses push for that.
We expose them to a lot of education of what to expect whenever they come in, because there's a lot of policy changes since we've started this new program. Moms who have delivered here before now will notice some changes in the way we do practice. We also offer prenatal classes for expectant moms. We are getting ready to start grandparent classes so that they can be more involved and understand the process a little more. We also have pre-breastfeeding classes that to tell moms what to expect.
And we're not only helping our breastfeeding moms, but also our bottle feeding moms by becoming more involved in the community through our prenatal classes, through our outpatient education that we give, as well as your hospital stay. We make sure that when you go home, you have all the resources you need.
The nurses at Rolling Plains Memorial Hospital are really great. They really have a lot of experience. I can really count on them and their medical knowledge whenever I'm in a situation. I know that they know what they're doing, they have compassion, they truly care about all their patients, and they really do a great job. They go over and beyond.
Most of our doctors not only deliver babies, but they take care of the baby and mom through the rest of their life. I mean, you can know them for years and years.
Rolling Plains is doing a lot to improve their overall image. New facilities, not only obstetrics, but the new surgery suites being planned, new hospital face. They're doing a lot to help the community. And this is just, the new obstetrics department is just one of those improvements that we're working on. And I think it'll be great for the community.